Good day, I'm GENIELOU Johnson from BSN 1A. In this video, I am going to perform the drug administration via intradermal and intramuscular injection. So, the rationale for doing this, if the patient has an allergy on his specific medication. For this procedure, we need first to verify the doctor's order. The rationale is to reassure if we're administering the right medication for the patient, thus it will. And lessen the harm, and the next is we need to perform hand hygiene to protect our patient. And observe another infection control procedure. The rationale is to prevent the spreading of microorganisms. And next is we need to identify and explain the plan and procedure to the client. The rationale for doing this is in order for us to know if we're handling the right patient. Of course, for the patient have awareness what will be going to do, why it is necessary, and why it is important. Next is we need to provide privacy of the patient. And the equipment are medication card, penicillin or the vials, aspirating needles, cotton balls, wet and dry, syringe, tuberculin for skin test, .5 ml syringe for intramuscular injection, hypodermic tray, and the waste septicals. So, first is pick up the tuberculin syringe and attach the aspirating needles. And set aside. Next is proceed to the procedure preparing the medication vials. Open the medication vials. Now that the rubber cell of the vials is exposed, clean the surface of the rubber cell using a wet cotton balls of 70% alcohol. And take the syringe and draw some are into the syringe and inject the syringe into the vial. Invert the vials and draw the exact amount of the medication needed. Now, if there is any bubble trapped inside the syringe, tap the barrel. And now we have to remove the aspirating needles and replace it with the right size needle that would be used for the actual administration of the medication. And now discard the aspirating needles. Use the waste receptacle. Also, do not forget to write into the medication ticket the name of the drug and the dosage. And first check the medication order on the patient chart, which is more reliable in the medication ticket. And now, introduce yourself to the patient. Good day, sir.
Hindi, ma'am.
I'm GENIELOU GEONZON, your nurse for today.
Okay.
May I see your response, sir? What is your name?
Brian James Tumbok, ma'am.
Your birth date, sir?
October 17, 2001.
Thank you. So, today, sir, I will inject you the amount of penicillin into your skin to check if you are allergic or not with the penicillin medication. It is okay with you?
Yes, ma'am.
Okay. And arrange the medication drug and into the hypodermic tray with the corresponding drug. And now choose the injection site free of lesion or discoloration. Select the site 3 to 4 finger width below the antecubital space and 1 above of the wrist. And position the client arm so that his elbow and forearm support the flat surface, then apply clean gloves. Now, use an antiseptic swab to clean the site beginning up the center, centering upward into the 5 centimeter. And now remove the cap. Stretch the skin tunned by gently pulling with the thumb arm and the 4 fingers with non-dominant hand. And pull the needle into the patient's skin. Insert slowly into the 5 to 10 degree angle until the resistance is felt. Advance the needle up to the epidermis. Put dry cotton balls and do not massage the area. Now encircle the blood with the blue or black pen and instruct the patient, do not rub or erase the mark. Okay, sir, we're done to your skin test, but we still have to wait for a few minutes to have a result, okay?
Yes, ma'am.
So please do not massage the area where I did the injection and do not erase the mark, okay?
Yes, ma'am.
Thank you. And dispose the used needle. And the next procedure is subcutaneous injection. Is the introduction of small amount of injection by means of syringe and needle into the adipose tissue beneath the skin. And in doing this, we have just to repeat steps done into intradermal injection. First is prepare medication, the equipments needed for the subcutaneous injection. We have to insulin syringe, we have the insulin syringe. And write the drug name and dosage into the medication ticket. And place it also into the hypothermic tray. And check also the doctor's order into the patient chart. Good day, sir.
Good day, ma'am.
I'm GENIELOU GEONZON, your nurse for today. So, may I know your response, sir? What is your name, sir?
Brian James Tumbok, ma'am.
Your birth date?
October 7, 2001.
Thank you. So, sir, today, I'll be doing subcutaneous injection. I have to inject insulin in this part of your abdomen. In this part of your abdomen, sir. It is okay?
Yes, ma'am.
So, insulin is to control your blood sugar. Since you have a type 1 diabetes, so will be alright, sir?
Yes, ma'am.
Okay. So, before we start, we need to perform hand hygiene. And arrange the medication card and the drug in the medication tray. So now, determine what site will be used and expose the potential injection site. So now, inspect the area of any bruising, inflammation, or edema. And palpate the site and avoid the area that is tender. Sir, are you feeling pain?
No.
Okay. And to make sure that you have the right size and the needle, and use the thumb on the forefinger of the hand to grasp a skin, fold the tissue, and measure the fold from the bottom to ensure that the needle is half as long. Okay, so place the patient into the comfortable position. Sir, please relax your abdomen, okay?
Yes, ma'am.
And now, use the antiseptic swab to clean the site of the vials. And now, use the antiseptic swab to clean the site of the patient's abdomen. And pull the needle cap and hold the syringe. And between the thumb and the forefinger of your dominant hand, if you're holding a dart. And insert the needle quickly and firmly to 4 to 5 degree angle, 45 to 90 degree angle. Pain is minimized by inserting the needle without hesitation. Release the patient's skin. Move the dominant hand and small injection the medication over the several seconds. Then quickly draw the needle and place a swab. And do not massage the area. So the last procedure is the intramuscular injection. Is the introduction of medication deep into the muscle tissue where the large network of blood vessel and can absorb it readily and quickly. So preparation of intramuscular injection medication, so that the doctor's order is 5 ml of morphine sulfate to address the pain of the patient sustained from a recent car accident. So before we could actually draw the medication from the vials, first thing to do the mathematical calculation of the exact dosage needed. So the doctor's order is 5 milligram of morphine sulfate is divided with the hand, which is 5 milliliter per ml. Okay, the desired dosage divided by stock on hand multiply by the quantity. So 5 millimeter divided by 5 milliliter times 1 milliliters is equals to 1 milliliters. We have a syringe gauge with 23 needle. And next, we have to separate and connect the rating needle. And connect the aspirating needle. And now open the medication vials and clean surface of the vial. And now inject the air to the vial and draw the exact medication needed 1 milliliter. So there are no bubbles. And replace it with the gauge 25 needle that we use to the intramuscular injection. And place this syringe to hypodermic tray. And write in the medication the name, dosage, and the frequency. And place the medication ticket also in the hypothermic tray. And discard the used aspirating needles into the waste receptacle. And check the doctor's order in the patient chart. Sir, good day.
Good day, ma'am.
So, I'm GENIELOU GEONZON, your nurse for today. So, may I know your sponsor? What is your name?
Brian James Tumbok, ma'am.
Birth date, sir?
October 17, 2000, ma'am.
Thank you. So, sir, today, Dr. Chris was prescribed you a amorphous sulfate to abbreviate your feeling of pain. Okay?
Yes, ma'am.
So, palpate the muscle area and examine the integrity if there are tenderness. Inspect the area for bruising, inflammation, and edema. If the skin shows bruise or inflammation, use other site. And help the patient find the comfortable position. So, my patient is side-lying position. So, for ventrogluteal injection, place the heel of the hand over the greater on the patient hip with the wrist amount almost perpendicular to the femur point, the thumb to the patient groin point, the index finger to the anterior superior iliac spine, and extend the middle finger and extend the middle finger back along the iliac cross toward the buttocks. The index finger, middle finger, and iliac form V shape. The triangle injection site is center of the triangle. And aspirate syringe by pulling back the plunger by your dominant hand. This is determined if you have hit the blood vessel. If blood appears, it means you have hit a blood vessels. So, inject the medication slowly at the rate of 1 ml and 10 seconds. After 10 seconds, slowly withdraw the needle. Place the patient with comfortable position and document the procedure. Okay, sir. We're done with the intramuscular injection. Thank you for your cooperation, sir.